Hypopressives addresses pelvic floor and core issues through breathwork and movement poses. It's a system that helps you relax and strengthen at the same time. What is wonderful about it is that you only need to do a minimum of 8 minutes, maximum of 20. So somewhere like 10 to 12 minutes is great 3 times a week to really start seeing results. It's something that you can fit into your life, your busy schedule, and these courses of classes keep that in mind because I know parents, mothers, women are busy. Unlike traditional core exercises that you might have heard of, like planks or Kegels, those squeeze contractions of the pelvic floor, Hypopressives works on pressure management. So we can literally change the tone of the pelvic floor through what we do with the diaphragm. We start to get movement into the ribs, into this lateral costal breathing, which changes the intra-abdominal pressure in the thoracic region and the abdominal area. This affects how the pelvic floor functions. We try and get the two working in synergy together, the pelvic floor down here and the diaphragm. As well as that, we work on the abdominal muscles, the back muscles. So our core goes from here to down below. Diaphragm, back, abdominals, pelvic floor. And then we've got our arm lines and our leg lines, which influence also. So through this whole program of classes, this is what I teach. Breathing, poses, they come together to strengthen your body in a global way. It's such a beautiful, graceful combination of the two. Hypopressives works through creating a vacuum in your body. If you can imagine a plunging effect. As we in-breath, we open our ribs, our lungs inflate, and our diaphragm moves. As we exhale, the diaphragm ascends, the pelvic floor and the organs lift too. Our bladder is fascially connected to our umbilicum. So as this vacuum happens and the belly button rises, together the organs lift. Now this is an involuntary action of all of these tissues. It's not like in Pilates where we're bracing or holding the muscles. We have to try and be really relaxed and focus on the breath, but the strength comes in all the poses that we learn. Through the movement poses, loaded and unloaded, so standing, kneeling on all fours and lying down on our back, we unload and load our postural muscles and our pelvic floor. So we start to train the body in lots of different positions so that we can get our body working really efficiently with us. I can't wait to share this method with you. It has been life-changing for me. I have seen my grandmother suffer with stress incontinence when she was alive, and my mother, and I did not want it to be my future too. It wasn't getting better on its own. So if I can do it, so can you. This method can also help women with the symptoms of organ prolapse. So cystocele, rectocele takes a little bit longer, and uterine. I've seen women improve their symptoms. I'll be teaching you a tool that you can use so when you do feel those symptoms sneak back, maybe it's because you've been on your feet a lot that day, walked a lot, ran, or maybe you're feeling stressed, and over time you start to recognize when you get your symptoms. You'll have the tools to help you. Diastasis, so when the linea alba, so it's the tissues in between the rectus abdominis muscles, they can thin. And that's a natural part of being pregnant. But for some women, it doesn't heal as fast as others. So sometimes you might still feel like you look pregnant a year or 2 or 3 or even more after giving birth. If that's you, this method adds tensioning into those tissues to heal better. Other things like back pain, shoulder girdle pain, again, through the breath work, we can start to shape the body. I have seen firsthand through the classes that I personally teach to my local clients in this studio in the UK, in Devon. And I can see women transforming before my eyes. I can't wait to help.